Okay, now we're going to ask for your tolerance here because we actually need you, particularly your reporters, we need you to be really succinct in order to cover the ground. There's been obviously 30 minutes plus of conversation at the table. We obviously can't have all of that fed back to us. We need succinct summaries for each question. And what we're going to do is answer each question around each of the tables before we move to the next question. So we talk about question 1 first, then question 2, and then question 3. And at the end of that, we open it up for other things you might like to say. So we're really asking the report back person to be ready, you know, rather than just, oh, is it me? Oh. Yeah. So to be ready and to also be as succinct as possible. And if it's been said already, we don't need to hear it again. This is cumulative. It's not a case of if 10 people say something, it has 10 times more weight than one person saying it. It actually, we're accumulating a picture which the board members can absorb and take into the formal inquiry next month. Okay, so we're going to do question 1 first, and we've got a microphone coming round, and we're going to go punch, punch, punch up this side and then down this side for question 1. So, what worked well?
What worked well?
Could you stand for us? Would that be... So if you stand and give us a delivery, that would be terrific.
Okay. What worked well? We felt that social media, Facebook, was the instant thing that worked well rather than radio and television. We were also thought the emergency service were absolutely brilliant. We can't thank them enough for what they did and how hard they worked. Those of us who were in the range when the bushfire came through, we got an emergency text from Telstra, and that worked rather well. And I think that's about it.
Okay, so mostly communications worked well, and the emergency services.
Yes, yes. But other than that, the question really didn't apply to us as citizens.
Yeah. Okay. If you pass back the mic, and we'll scoot along. What worked well on this table? Could you stand up for us? And shall we?
What worked well? Had a fire brigade. CFA responded well, and the volunteers. Taxis and buses were available to help with the evacuation, apparently. Attempted some support for community, and someone used a vacuum from the neighbourhood house. Oh, that was after the fire. Okay. Mm-hmm. Anyway.
Okay, thank you. Next table.
The community banding together worked well, the CFA website and Vic Road website, and a lot of other things have already been mentioned.
Okay, thank you. And the last table up here. Are you still working on who's going to report? We can come back to you if you like.
One person on our table found that the internet radio provided better reception than other forms for them.
Okay. So we've got a little list of what worked well. We could get a bigger one maybe. Okay, this table here. Yep.
Yeah, I just agree with everyone else. It's the same. We've said the same thing, CFA, and I'd like to bring up something for the volunteers, for the local ones, which we deliver Meals on Wheels, and we delivered Meals on Wheels to the older people in Morwell during the fire, so that was a great thing.
Worked well, did it?
Yeah, worked well.
Mm-hmm.
Worked very well. Yeah, the volunteers from the CFA too. They, not the management, that did a great job.
Yeah. Okay. That's good. And last but not least, what worked well?
We had a lot of the same. The CFA operational was an asset with the volunteers. The constant update from the CFA, the radio, the TV, newspapers, Facebook, the ABC, they had constant updates, which was good for the ones that haven't got computers. The emergency service in the area were a blessing when they come around to give us all the handouts, because up to that point we didn't know whether we were coming or going. The incident controllers with their regular updates, and the emergency text from the CFA.
Great, thank you. So a lot of volunteer responsiveness and some of the communications worked pretty well. Lana, by the way, is taking all this down to complement the stuff you've written on your notes, which we're all going to collect at the end of the evening. So let's then, why don't we start up the other end this time? Let's talk about question number 2. Okay, so they're the things that worked well. What didn't work so well? This might be a longer list, I suspect. Okay, top table. Have you worked out who's reporting back yet? Okay, drop down one, and if you could work out who's reporting back, that'd be really helpful. Okay.
I'll talk slow because there's a long list for you. What didn't work well? Confusion, lack of communication, coordination, cooperation.
This is you talking slowly, is it?
Sorry.
Okay, far away.
Too much contradiction, mixed messages. Not enough information. The watch and act, for example, the fire app was good in some parts, but it was delayed. So we got some of the information after it happened, so it was a bit too late. What else didn't work well? Lots. The hospital's information saying that there was no presentations or no more in presentations. We found that, being told that was wrong. The monitoring of the CO levels we found didn't work well. The information coming out from media wasn't coming well. The information from the mine saying that there was no fire in the mine when we could clearly see as residents there was a fire in the mine. Sorry, it's about 4 pages of them.
What page number are we on now?
3.
Okay.
The EPA did not work well at all. We found out that they didn't start monitoring until 2 weeks after the fire started. The testing done on the ash and the air didn't work well. They only did 2 days of VOC testing. The EPA staff and technicians didn't work well in the way of telling us, the information that we needed to know. The Health Department, Rosemary Lester, did not work well at all. The information she was given was contradictory. Sorry, that's I think it for the minute. There's another page here.
That's a pretty.
I think that's pretty much it for the minute.
Pretty good list. Yes, thank you. Top table worked out who's reporting back yet? No? Yeah, we've got someone. I think he deserves a round of applause. He's been drafted.
I've only been here for a little bit and I've just been seconded into it.
Okay, what didn't work well in terms of what your table views are?
Well, I wasn't here when this bit on, so I'm just going to read the notes.
Okay.
Fire apps not responding in Morwell until the burning and everything else was close. Very hard to read this writing. Notifications were coming in too late. Evacuation came too late. People were concerned of the fire 2 hours previous and didn't know what to do. People wanted to leave, but roads were blocked and there was no notification of which roads, where to go to and where to get directed out of the place. Confused information on road closures. People ready to evacuate, leave, but not clear on information on exiting the area. Residents were informed and evacuation, but but businesses were not given any direction to stay open. Some people didn't fall into the category of respite payments.
Okay.
I've got 3 pages here, so I've got to... Only people immediately adjacent to the fire, shops, people were directly informed about respite payments.
discussion about the significant input of the smoke on people's health and well-being, exposure to the fumes of smoke. For some, fume smoke just was bad inside and was out.
Keep going.
Yes, it was. In other words, some smoke was in bad in some houses, just as it was inside and out. One person significantly impacted, shortens health, difficulty breathing, referred to GP.
It sounded like we're getting into detail of the conversation. Could you just sort of run your eye down it? And
yeah, well, I'm only reading this for the first time, so
yeah, I know.
It's making it a bit hard for me. When the highway was open, there was still significant smoke on areas. Concerns at the stability of the highway and the road current to the issue, as with past issues from the same area of the roads. Firebombing with water on the coal, giving those of people that have worked with coal know that you don't normally hit fire with a bomb type of thing because it explodes and ignites it, and whereas you'd normally have to spray it with fine spray, and that caused more rash. Sorry.
Quick as you can.
The only one that wanted to speak up. I'm stuck with it. A lot of personnel not having the knowledge about fighting the fire effectively. Treatment of the discussed part of the mine or disused part of the mine was not managed properly. Firefighters were not adequately something about with breathing apparatus. That will come too late. People in the Wallace Street breathing the raw smoke. Compared to firefighters they were all told to have breathing apparatus, but people in the immediate area never had to, they didn't have to have breathing apparatus. Okay. Firefighters exposed to contaminated waters, that's in other words the picking of waters up out of any dam that could have been anything. And I don't know what the last bit is.
Let's leave the last bit if you can't read it.
Sorry about that.
Thank you very much for ploughing your way through that. I think we've got a good list out of it. Okay, let's keep coming down here. What didn't work well? We've already got a formidable list. Can we not just repeat stuff we've already heard? But
I'll try,
what
but
else?
Again, there's lots. So what didn't work well? Roadblocks didn't let people in or out. Lack of information, so the communication lacked all throughout the fire. Some people saw flames and hadn't heard about what was going on. Community had to help community before proper assistance was available. They had to help vulnerable people, disabilities with mental illness to evacuate, so there was no plan for, or just generally the fire plan was inadequate, some people felt. Lots of people didn't have transport or weren't in a position to leave. Texts weren't user-friendly, some people said, so some said that the elderly didn't like not having the ability to ask questions about the text that they were given to have some clarity. In the early days, the smoke was attributed to the bushfires in East Gippsland. I'm not quite sure what that is.
Keep going.
Just disorganisation throughout. Children in schools, teachers had to call it themselves rather than relying on the EPA, because sometimes that wasn't, in different areas of Morwell, it was reading that it was okay, but people had to make the call that it wasn't okay for kids to be outside. Monitors were put in staff rooms where there was no one in any of the times. Emergency alert was a computer voice on landline. Oh, that's already been said. Uncertainty about what to do for schools, teachers, creches, childcare facilities. EPA monitoring up to a certain threshold only went to 150, which was very bad. So there was confusion with Rosemary Lester saying that there was nothing to worry about when we had readings up to 1,809. Sensitivity increased over time. Masks were out of date that people were given. The elderly could have relocated. Some elderly didn't choose to relocate, I think that might mean. People were throwing out furniture, carpets and things like that because I couldn't get the smell out of them. Had to leave town because they had headache, shortness of breath. Some people couldn't close their business or couldn't stop work, so they couldn't relocate. There were options available, but not everybody could take them, and some people didn't have any options available to them. The carcinogenics were inhaled but told to be okay. Property values have declined, not just in Morwell but other areas. Buckets were said to have been asked from the community, but nobody that anyone's talked to has said that they needed or wanted a bucket. Pressure hoses were a ridiculous idea because of the asbestos. Middle class were discriminated against, not having any support. Lack of knowledge of Old Faithful, that seemed to be a surprise to people. Didn't have information about what to do with pets and livestock. Nothing on TV about grants. The web page of LCC wasn't updated. Disorganised again, said they knocked on doors or came to their business. There's a massive hole full of coal, which is fuel that was allowed to be exposed when it's pretty obvious that we have fires in this area quite regularly. The clean-up didn't hear back for a week. Some people still haven't heard whether their house is going to be cleaned or not. Lack of expertise. Lots of people are still sick. LRH were using clipboards, so there's suspicion about why that wasn't recorded on computers, their presentations. A downplay on the presentations in hospitals, and people not trusting information provided.
Ooh, you must be exhausted.
A little bit. I feel sorry for the scribe.
Well, we do have your notes, so we're not going to lose any of this. And that's 3 quite long lists. I can see why what worked well is quite a short list. Okay, let's keep recording this because it's obviously getting quite a substantial list of things which the Board of Inquiry would like to hear. What didn't work well?
We felt that what didn't work well in the lead up to the fire wasn't relevant to us. What didn't work well during the fire was there was a total lack of communication. That was from every strata of government, from local government, state government and the non-existent federal government. We didn't hear a word from them. The information that came through on the health aspects that most people were very concerned about was, for most of us, an outright lie. It sounded as though the whole thing was to placate the population and make sure that they didn't panic. And yet the lack of information and the obvious incorrectness of the information led to a whole lot of panic among people who were worried about their health, worried about their homes, worried about their work, worried about the fire, worried about everything that you can think of, but none of it was regarded as important by the people who were handing out information. We particularly feel that the EPA was, they were worse than useless. They were negative because there wasn't one small atom of truth in all of the bulletins that came out from the EPA. They were obvious lies. They would come out and say that the air was fine. You know, open up your windows, open up your doors, breathe in the air, breathe in the carcinogens. You know, never mind what happens in 10 or 20 years because we won't be in office then, so we won't care. So all of this in the health is something that's going to be obvious down the track.
Okay.
Now, what else didn't work?
Oh, we've only just
Goodness
started.
me. The financial pressure that were put on people.
Mm-hmm.
People here, this lady here, lost 2 weeks' work because of her asthma. So many people left the district because they couldn't stay in their homes. Young couple here still aren't back in their home in Morwell. It is uninhabitable. So what do? Nothing. They're given a bucket. A bucket! Can you imagine that?
Okay.
Yes, I know. It sounds so terrible, though. The respite centre, when on the days that the wind blew west, was at Moe. So where was the smoke? In Moe. Why wasn't the respite centre put further out of the valley? Mm-hmm. A lot of guilt from people, because I know that I come from Churchill, and at Churchill we had the smoke, we had the stink, we had the bad air, we had the toxins, we had all the hazardous environment, but we didn't start to be like the people who were really at the centre of things. So we felt guilty. You can't gristle because there's other people worse off. Mm. There's always other people worse off. It created divisions in the community because who told the smoke it could stop down that road? Who was it said to the smoke, okay, you can go this far, and this far you're fine, this far, no, you smoke. It was so ridiculous. We had I can't recall one feeling of being supported by any form of government. Not by any one councillor, by any one member of the state government, and certainly not by any member of the federal government, in what was one of the worst disasters ecologically that there has been in the world. Another thing was there was a big rally here, and one of the people from the community handed out forms, health forms, for people who were suffering sore throats and stingy eyes and bad chests and blood noses. But who did it from the government? Nobody. It took a local member of the community to actually get some details of the health of the community.
The ones who were well enough to go?
The ones who were well enough to go.
Yep.
The ones who weren't out of the area.
Yep.
And so I think a lot of the other things we had to mention have already been mentioned, so thank you.
So that's the Precy list. Thank you. We're getting quite a formidable list, and it's extremely helpful information.
Thank you. Most of it's already been said, but I would just want to point out from my point of view, I had to evacuate my house for 3 weeks, and I found it very frustrating to come home, or try and get home, get into the house in such a mess that it was. Trying to get information from local government was non-existent. It was very bad. And someone said down here about the payment for all the affected areas. Well, that was not right. It was only the pensioners and the healthcare card people that got looked after. I'm classed as a low-income worker, and I did not get a bucket, a mop, nothing. The only thing I managed to get was a vacuum cleaner. From that point of view, I was very frustrated, very angry for a long time. And yeah, just trying to get information was the worst part. Trying to get help, someone to listen to us, someone to apologise, anybody to do anything. It was just hopeless.
Or someone to show some interest, it sounds like. Yeah. Okay, last but not least, what didn't work well that we haven't covered before? It's good if you do, so we can have it on record, if that's all right.
Good on you. Thanks for that. The readings, EPA first, the readings were not taken in the right locations. The readings were delayed. The quality of the readings were not good enough. CFA management not good. The critical time at the start of the fire was not managed well. Outside crews were brought in and did not have the local knowledge or expertise expertise. Fire breaks were not managed well. Mine, sewers could have done more to manage risk regarding fire prevention. There was a lack of communication. Chief Health Officer giving misleading information and treated the local community with contempt. Politicians came down too late. The clean-up was terrible, non-existent and still ongoing. Lack of information and communication from the government and authority representatives.
Right, thank you very much. Now, I'm not going to attempt in my wildest dreams to summarise all of that. We've recorded it, and both microphone and here, and it is on your tables, but it's quite a formidable list. So thank you for that. Can we then move to question 3, which is the time at which you are then, if you like, putting yourselves into the mindset of the board members of the inquiry, and actually what do you think should change? What do you think this should lead to that is different, either to prevent or to respond or to catch up, follow up from what's happened? So let's start with this table and we'll zigzag up the path. So.
Well, heaven forbid that it should happen again, but it probably will, because we live in an area where it's just as likely to. What should be done differently to prevent such a fire? Well, obviously it needs to be a well-run, well-trained fire services at the power station, at the coal hole. There used to be a wonderful fire service when the SEC owned the property. Now there is nothing. All of the pipes have been torn up, the sprinklers. It needs to have a total watering service system installed again in the cut. There should be a concentrated effort from all of the relevant authorities to make sure that the firms who run these places fulfil their obligations to regenerate, to keep the area safe. And it seems that there is a reluctance on everybody to keep an eye on, not only keep an eye on, but to make people perform the way that they were signed up their contracts to do. So I think that the fire prevention, it will always happen. But all of the things that used to be there when the SEC ran the mine, put them back again. In response to if it happens again, if they put in the firefighting services, if they put in the water, if they put in the sprinklers, it won't be as bad as it was. And if there ever is a time when they need to respond, let them have an emergency plan. Let the government, let the council, let everybody have an emergency plan where everybody is treated equally in the community, and the community is created together rather than apart, which is what has happened now.
Thank you. That's twice you've got applause. This is very appreciative audience. Can we just we'll go there and then come back to here, so we're coming up the middle? Okay, what should change?
So in the future, that with education, that people taking responsibility for children should be better informed.
Could you stand for us?
Yeah.
Just so we get a full visual.
Again, the fire crew in the open cut, a contingency plan, better rehabilitation, sprinklers, etc. Fire breaks around the open cut. Someone needs to regulate the regulators. That seems to be a common thing said. There should be some emotional support offered freely throughout the community. Conveyor belt should be removed and not just being a fire hazard thrown on the side of the mine. It needs to be called a disaster. Russell North actually accidentally slipped that out, but we went to document that. Government not to treat communities as fools.
Okay, so let's go to this table here, and then we'll jump up and across. What should change?
I've just written down batter should be covered in all disused mine. Sprinklers should remain operational and in all disused mine areas, and a fire plan update in all mines to be adhered to. Stiffer regulations from government for disused mines, and buffer zones should be wider and longer.
Okay, thank you. So it's quite a bit about what the mine should do, prevention and all that. Yep.
Righto. 1, a recovery centre outside the affected area. Train local people to respond in emergency situation, including those specific to the area. Better rehabilitation of the mine. Legislation to make it happen and to enforce required standard in every respect, in particular on mine rehabilitation and responsibility. Better clean up and follow up. Better emergency response, demonstrated ability. That's it.
Thank you. Straight across.
What should be done differently? The buckets. Sorry, I'd say that. An immediate evacuation of people should be done, of not just people but animals. Don't try and cover it up. Don't try and lie to us. Better flow of information re water quality, the rehabilitation of the mine. There's a $15 million rehabilitation bond on the mine that should be increased so that it actually covers the rehab of the mine. Full training for the mine firefighters, not being made to pay for their own training and do it themselves. There should be a proper clean-up package set up and organised and set in stone. The mine should be equipped with proper equipment, CAFS foam trucks. The DPI needs to have a better knowledge and understanding of their job as regulators, and there needs to be a register for everyone who is exposed to health reasons or exposed during the fire for health reasons, so that in the long term, in 10 or 20 years' time, when our children want to have kids and they get told no, that we have a reason why.
Okay. Thank you. And last but not least.
Nobody else wants to do it. Distribution of the funds only to those on healthcare cards. When the broader community was and others breathed in the smoke. Maintain the mine to a safe working situation so it doesn't happen again. Utilise appropriate firefighting methods for the fire. Firebombing is not an appropriate method to fight a coal fire. Now, this went on for weeks with helicopters and planes, and anybody that's been in the mine knows that that's not an appropriate way to do it. Notification of when we get dense smoke to all the people in the town, and that includes the shops and the residents and that, when we should be shut down and move on or evacuate. Thank you.
Yep. You want to add something? Okay.
The GDF sewers should not be... Sorry, GDF sewers should be held accountable for going to a school, offering help and then retracting it during the actual fire.
Oh, okay. And we forgot. We're going to open up in a minute, so people can add things.
This is when Simon mentioned...
Can you stand up so you can...
Sorry. Simon mentioned that everybody should be having the ongoing testing or whatever. I think there should be, for the whole valley, for everybody, there should be every single person who resides here, because 95% of the population are under the impression that they're safe and they're happy, and their blood noses were blood noses and their viruses, their gastro was gastro and their vomiting was another bug. I think there should be a mandatory questionnaire that everybody needs to fill in, that they actually have to fill in or they get fined or something. There needs to be something so that we actually get proper information, because I know a lot of people who have had a lot of symptoms who haven't presented at the doctor because, oh, it's just gastro, everyone's got it, or it's just this, or it's just that. Oh, I thought it was a bug, that everyone's got cold sores up their nose and everyone's bleeding. So I know that there are a lot of people who are further impacted by this, who either haven't been to the doctor or couldn't get a doctor visit at the time because the doctors were backed up. So I think that's something, in order to get a proper understanding of the impact of it, we need to take it wider and take it to 100% of the population.
Pam, could I ask you to... Sorry to put you on the spot, but you mentioned to me earlier that someone had asked you what they should do about registering the health issue. Okay, can you just wait for the mic so we get it, everybody hears it?
I'm a resident of the Valley and I worked in the Valley for the whole time, and what I have advised my family and myself to do is to register with your GP. When you go to the doctor, you tell them that this is where you were, you want it on your file, so that if there's any comeback or there's anything that happens, your GP can monitor you. And who better than yourself to monitor your symptoms? If there's any change in any of your lung health, anything, you know, you're the ones that are monitoring your own bodies. So there is, I'm the respiratory nurse at Latrobe Community Health Service, so, you know, I do assessments, advise people to see their GP, whatever. But it's up to you to monitor yourself and to let the doctor know.
Okay, thanks very much for that. It's very timely, very helpful. Okay, we've got a few minutes, not all that many, but we've got enough to open it up a bit. And the question I'm really asking is, because of the way we structured the questions or how the discussion happened at your table, are there things that you came tonight wanting to say that you haven't had a chance to say, that we haven't heard, or is not on the notes on your table? So are there other commentary? We're not looking for political speeches, we're looking for commentary that you wanted to make, but we haven't heard yet. I've got 1, 2, 3, 4, 5. Okay, so 1. Yep.
I just thought it was an interesting comment that Mr. North made, that it was a great outcome for all of the residents of the Valley to now have asthma plans who didn't have them previously. It was a, what was it, undiagnosed pre-existing conditions that have now come to the fore. And he thought it was a great outcome. That illness that wasn't there before we'd found now.
Okay, thank you. Just move along, stay on your table and just do those quick 2 there and we'll come over here.
Just 2 quick points, and one was because of the young lady who mentioned here. I was actually in hospital 4 days ago and I was put in for the day because of breathing asthma, and I've been told I've got pneumonia as well. And I didn't get left with the hospital with a report. You know, when you leave and they say, take this to your doctor, they didn't give me that. I asked them for it and they didn't give it to me. So saying go to your doctor, I have, my doctor's actually at the same medical centre where you work, so, but that was just one point that you're saying, look after yourself. If you go see your doctor, make sure you get something to say that you've been to see your doctor, because otherwise it can be said differently. The other point is that the EPA website says they have their colour charts. Black was very bad, 150 and above is black, which is very bad. There was times during the fire and the smoke, it said it was 1,500, 1,800 and more. Something should have been done way before than waiting till later.
Yep. Okay, and woman in front of you, I think.
I've just got something I just thought of before. I'm a local artist, so I'm just speaking on behalf of local artists in the region. The gallery was left open and they've got a collection of art, the Seabus collection, that's owned by the Superannuation Fund. There needs to be money given to the gallery to clean all those artworks, because the whole inside of the gallery absolutely stank of smoke, and if you can smell it, then there's residue left on those artworks. Is there going to be any money given to the gallery to help clean those, seeing as it's owned by a superannuation fund?
Well, can we record the question rather than try and answer it, because it doesn't sound like something we can answer.
Yeah, is there going to be any money given to the Latrobe Regional Gallery, which is a significant regional gallery and has a significant collection of art?
And there may be other institutions that equivalently have had damage, but that's a question which we can take into the hopper.
And as there's more fires in regional areas, there's going to be more of this sort of issue.
Yeah. Okay, can we pop over here? I'll add you after the one over here.
Can I just just ask a question? I'm getting really frustrated with insurance companies. No one wants to take responsibility for nothing. So where do we go from here?
Rather than ask the question, can you put it in the sense of what should happen?
What should happen.
What do you think should happen with
Well, I think someone should stand up and take responsibility for cleaning the ceilings. Because you can clean the house and then you turn around and you go like that and it's all coming through the lights and the vents and things, the bathroom fans and things. So, and nobody wants to take responsibility. The Shire...
So someone needs to take responsibility, and the insurance company...
Insurance companies won't look at it.
Okay.
No. The housing insurance won't cover it. The contents won't cover it. Government won't cover it. So council won't cover it.
It needs a solution from amongst those.
Who's going to cover it?
Okay, thank you. Now, we had someone here, and then there was someone else. Oh, we're getting lots of hands. After this one.
I don't like to take up people's time, but I'd like to share our story, if you don't mind. We're the early 30s, we have a job, we evacuated from our home on the south side of Morwell, down near the football club, nearly 2 months ago now. And we can't move back into our house because I have severe allergies and I can't breathe after being in my house for half an hour. My insurance company won't cover me because of the wording of our policy. We've disputed it and they've still said no. And Latrobe City gives me a bucket. And it's really, it's upsetting. I would like to see some... We feel we've been abandoned by every level of government, every agency that should be there to help and support us. And I just, it's actually quite emotional to talk about it. So yeah, I don't know what I'd like to make sure that feel like we're supported and have someone advocate on our behalf, because we try and talk through either the local paper or whatever we can, but it just doesn't seem to make an impact, and that's why we're here tonight, to try and have our story heard and influence something to happen to help our community, to help all our people, because it is a health risk for us to move back into our homes and for us to be expected to do the clean-up on it ourselves.
Thank you very much for sharing that. Now I had one here and then one there.
Thanks. The property devaluation, properties in Morwell, the Smarties say, the real estate agents has dropped by 30%, so you get 30% less on your property if you come and try to sell it. Now, trying to sell a house in Morwell now would be like flying to the moon, I'd say. You wouldn't have much chance, so that's all I'm going to say. Thank you.
Okay, thank you. So that's an impact from what's happened. Yeah. Can you just hold off? We had one here before you. And then we're going to run out of time pretty soon.
Sorry, I can't stand with my back. I've got a number of medical problems. I shouldn't even be here tonight with the state that I'm in. What this man has just said about 30% of the properties have dropped, I believe we should be compensated for that. Furthermore, I believe there should be a class court action that should be taken for what's happened to all of us in the valley, but Morwell residents in particular, what we've been through. We have been through a living hell. The way we were left, no contingency plan, and it was just the volunteers that we could rely on, and word of mouth, hearing from people. I think it's disgusting, and I think we all deserve to be paid out. And as far as the EPA go, I'm absolutely disgusted in them, but that doesn't surprise me. I've been through something with them before in the past myself. And as far as carcinogenics go, we all know what they're like. What are we going to do, wait 20 years down the track? And what, when we're all dead and they're out of Parliament and they're on their pensions? And then our children's children and our grandchildren, what are they walking around with? Cancers that we don't know about, but what, the government aren't reliable for them?
Yeah, okay.
And us now. What's happened to all of us now? That's all I have to say.
I've got one more. We don't want to repeat, if that's all right. Oh, you really want to squeeze something in? Okay, in a moment.
What I'd like to know is what would have been the response from government if this was 2 months out from an election? Now, what I've seen in all our local members and everybody else and federal members, I mean, where were they? I mean, it took them basically 2 weeks to get here to even start thinking about it. I mean, when you talk about properties and everything else, I've got personal friends that had their house valued 12 months ago. About 2 weeks into the fire, they had their smoke. They had their house valued again, and they were told $60,000 less if we can sell it. Mm-hmm. And I think what that lady brought up there about properties and everything in Morwell, I mean, we're all sat here with the stigma now, and it's never going to go off us. It's the same as if you look at Moe with Jade and Liskey, you look at that Snowtown with the bodies in the barrels, the same thing. We're called Smoketown now. Now, I happen to be away for a couple of weeks, and I happen to be up in Darwin, and everyone up there knew everything about Morwell and the smoke and everything else up there. So I mean, we're not just talking a local here. Everybody was listening to it in Australia. So we're really now, like you say, with our properties and everything else. I mean, really nobody. Who would buy a property here? And as far as, like you say, all these people here, like I'm down in Bridal Estate. Now we didn't cop it as much as these poor buggers up here in Wallace Street and everything. But the only people that seem to get, if you're over 65, you're bloody disabled, you've got a healthcare card, or you lived in Wallace Street, you're only ones that were looked after. What about the rest of Darn Mall? And there's a lot of other people that went further towards shops and the businesses that lost all their money. Nobody's talking about that.
Okay, thank you. Now, we're really running out of time because we did say that people would go home. And I'm a bit reluctant to have second and third goes, but if you're very quick comment.
It's just aside from the housing one, is the people who rented who had to leave or did leave or moved, still being forced to pay their rent by landowners, which has put a lot of people out of pocket, notices to vacate because they haven't paid their rent. And then quickly on the businesses side of it, the government said that every business was given a package or given money or grants. We've got lists of businesses that still haven't been offered anything and been told that they can't receive anything.
Okay. So, are we done? Very quick.
Just a serious clean-up and very serious clean-up of all inside, outside and around the houses.
Okay. So clean-up is a theme that's consistent. Is it very quick?
Yep. I think we need to know what GDF Sewers is going to put into all this. People are talking about governments. There's been no talk of what they're going to pay. Are they going to pay for the cost of this firefight? We should actually be given the opportunity to leave because a lot of us have got ongoing health issues, and if our health doesn't improve in 12 months' time, we're going to have to leave. And then we're left out of pocket. There should be some sort of buyback scheme so that Morwell residents that own houses are able to have their homes bought back so we can leave because our health is really suffering.
Thank you. Okay, so I really need to call it to a close, if that's okay. The Board of Inquiry members will stay on to chat with you if you wish for a while after we break, which we'll do very shortly. But before we do, can I ask the Chair, Bernie Teague, if he would like to say a few final comments?
I'll just be short because we've had what I think is a very informative process of our listening, and I've taken an enormous number of notes, and I can see that it covers a vast range of areas. It's almost information overload at the present time because you've put so many propositions about so many different aspects. But thank you very much indeed for spending the time with us tonight and going over them, the matters in such a way that, and I'll express my appreciation on your behalf to Michael, so that what I'm doing is adding thanks to him to the thanks that I give to you for your great cooperation in over the last 2 hours. Thank you very much indeed.
Okay. Thank you. Thanks very much, Mr. Chairman. Thanks very much, Mr. Chairman. Thanks very much. Okay. That's it for the formalities. We'll be milling around. There's lots of sandwiches, etc., to finish off for us, if you would. And thank you very much for coming and for all that input, which you are probably aware is a copious amount of data that the Board of Inquiry will find extremely useful. Could you leave the notes, please, on the table so that we can collect those and build them into the report? Thank you very much.